welcome to this spay video. This video we're going to talk about spaying your cat or dog. Spaying is removing the ovaries, which is the reproductive tract in your pet's body. It used to be a surgery where we removed both the uterus and the ovaries. In the last 5 to 10 years, the standards of care have changed, and actually now we just remove the ovaries themselves. Surgical time varies depending on how big your pet is. So a cat or a small dog, the surgical time is about 15 minutes. A larger dog or a more obese dog can be 40 to 50 minutes. The surgery starts in the treatment room where we prep them for surgery. So after they're under anesthesia and we're monitoring them and they're doing well under anesthesia, what we're gonna do is turn them onto their back in a padded trough and shave an area for surgery. This shave area depends on the size of the animal. So anything from about that big for a small dog or cat to that big for a larger dog. And once we've shaved, then we're gonna antiseptically clean with some sterile soap and alcohol. That's just to keep the area nice and clean. Then we're gonna put a sterile towel over top of that site to keep them clean while we move them into the operating room. So once that's all ready, we're gonna move her into our operating room where we've got our own anesthetic machine and start getting her ready for surgery. The nurses will put some local freezing agent in over the area where we're gonna make our incision. While that's all happening, that's our cue as veterinarians to start scrubbing and gowning and gloving up. And then we'll meet her in the operating room. And once we get in the operating room, then we're gonna open up our surgical pack, which will have all of our sterile instruments inside and our sterile drapes. Then we are gonna take our drapes and we're going to put those over top of her to keep her body all clean and sterile. And there's gonna be a little area of skin peeking through where the surgical site is, okay? And again, all of this sterility is so that she's clean and she doesn't, decreases the risk for infection. Once we're all prepped and ready and gowned and our drapes are all on, then we're gonna start the surgery. So they make an incision just above the umbilicus, or really where the belly button is, and extend it down. Again, depending on the size of the animal, the incision will vary. So for a small dog or cat, it might be this big. For a larger dog, it might be around that big. So we're gonna make an incision through the skin, through the fat layer, and then lastly through the muscle, and that will allow us access into the abdominal cavity. Once we're in the abdominal cavity, we gotta find the ovaries. They don't sit up here, they sit way back here, right below the kidney. So we gotta go in, find them, pull them up to the incision. This ovary here, if my fist is the ovary, is attached to the body in 2 spots. Here, there's a suspensory ligament with a blood vessel in it. And over here is the uterine horn. So the uterus is a Y-shaped organ. And the uterine horn attaches to that ovary here. So I've got 2 places where I need to put some sutures to make sure that, you know, I can cut the ovary out safely. So first region I usually work on is on the suspensory ligament side here. So I'm going to put a knot around that bundle of blood vessels, and that's so it doesn't bleed when I cut and take the ovary away. I always put a second set of ligatures or second knot or double ligate. And the point of double ligating is just in case that first knot fails. If it were to come off, I've got my backup there. So we always put 2 knots on. Once the 2 knots are on, then we can make a cut and then take the ovary away from this blood vessel. Then we check and make sure it's not bleeding, and then let it go back into the belly. And then the same procedure is done over here where the uterine horn attaches to the ovary. Knot, second knot, cut, and we've got our little ovary, and that can go onto our surgical tray. We check our uterine horn, make sure it's not bleeding, and it goes back into the body. We do the exact same procedure on the other side. And then when we're all done, we usually will do a gutter check. So we will open up the belly and we'll find all of the surgical sites, all the pedicles, make sure they're not bleeding. If they are, we just pick up the pedicle, put another knot on. Usually they're not bleeding, but if we need to, we can do that. If we're not bleeding and we're doing well, then we're gonna close. So we're gonna close the incision in 3 layers, absorbable suture, meaning it gets absorbed. They don't need to come back for suture removal. We close the muscle layer, fat layer and then the skin layer. The skin layer, the sutures are just below the skin surface. So again, no sutures on the outside, it'll all be underneath, nice and neat and tidy. When we're done the surgery, we usually put a little bit of ice on top to help with inflammation. And then we give you a call when we're all done. In terms of recovery for a spay, it's a 10 to 14 day recovery time. You have to keep in mind, this is a major surgery. They've had abdominal surgery, so no running, no jumping. Leash walks only for the next 10 to 14 days. It's super important. If she goes and runs and jumps, she could open her incision up, so please don't let your pet run or jump. Also important to keep the incision dry and clean. What will be helpful is we'll send her home with a onesie jumper and a cone collar to help make sure she doesn't lick at her incision. The cone collar can come off when she is supervised. So during the daytime hours when you're there with her. At nighttime or when you can't keep your eyes on her, please put the cone back on to help prevent her from licking at her incision. They will still lick through the onesie. When the 10 to 14 day period is up, please bring them back for a recheck exam. We want to make sure that the incision has healed. That's pretty much it for the spay surgery. If you have any questions, please let us know.